So frontal bone, parietal bone, occipital bone. This suture is the coronal suture. This suture is the sagittal suture. This suture is lambdoid suture. This area where the coronal suture meets with the sagittal suture, this is called as it is called as 1 minute. Okay, this is called as the bregma. Okay, this is called as bregma. Now, and this area where the sagittal suture and the lambdoid suture meets, this area is called as the lambda. So bregma and lambda. This bregma and lambda, it has some importance. When the fetus is developing, okay, and when the baby is born, these sutures, all these sutures, they are not completely formed. There is some gap in between the sutures. So because there are two bones here, and this is also two bones which joins later, because there is a lot of gap here, there is a big space which is present here. That space is called as the anterior fontanelle. This anterior fontanelle, you would have seen in small babies, if you touch on the head, you can feel that there is something just below the skin. You can feel that there is membranous thing, there is no bone. That is the anterior fontanelle. And this anterior fontanelle, when it will completely fuse, it will fuse by 18 months of age. That is 1.5 years of age approximately. It will fuse and it will form bregma. Then this is the posterior fontanelle here present behind. This posterior fontanelle will fuse approximately around 2 months, into 6 to 8 weeks. It will fuse and it will form the lambda. So bregma and lambda are important things. And why these things, how it will help during delivery of the baby. The head of the baby is the biggest circumference. Largest circumference is the head of the baby, which has to come through the vaginal canal. Okay, so this is the biggest circumference. So when it's passing through the vaginal canal, these bones can mold. Okay, because there is a gaps here, so it can mold. If it is molding, the circumference will reduce, and it becomes easy for it to pass through the vaginal canal, through the birth canal, through the cervix and the vaginal canal. Okay, so because that is one of the very important reasons why these sutures are not fused, because all these sutures, they are open. Because of that, bone will not be like this, it will override, and when it is overriding on each other, so what will happen, the circumference of the head will reduce, and when it is reducing, it becomes easy for the for delivery. Okay, so that was norma verticalis. Actually there should be a foramen somewhere in this region, that is called also parietal foramen. It is not there, so forget it. Now on this sagittal suture, the highest point on the sagittal suture is called as the vertex. Vertex is the highest point on our head. Remember, vertex is the highest point on our head, and it is present somewhere in this area, in this sagittal suture between lambda and bregma. Somewhere in between, in this area, you have the vertex. Then you have a swelling here and here. These are called as the parietal tuberosities or parietal tubercles, you can call, here and here. When you see the skull from the front, which is called as a norma frontalis, you see many structures here. First, we will again go from bones and then other structures. What are the bones you will see here? This is the frontal bone. Okay, this one, these two are the nasal bones, small nasal bones. Okay, then you have this one, is called as the zygomatic bone. Okay, so frontal bone, nasal bones, zygomatic bone, maxilla. This is, you know, this mandible. Okay, so other than this, you can see this bone or this bone. Okay, sphenoid. This is sphenoid. Okay, this is sphenoid bone. One small bone is actually present in this area. Okay, in this area there should be a small bone here which is called as the lacrimal bone. Okay, lacrimal. So frontal bone, nasal bone, maxilla. This is maxilla. This is zygomatic bone. This is the sphenoid bone, and lacrimal bone, and below you have the mandible. What is this big hole here? Orbit. This is called as orbit. Okay, this is the anterior nasal aperture. The anterior nasal aperture. Then here you have some few foramens which you should know. This foramen is called as superior orbital foramen. What you are seeing here, sometimes this foramen might not be complete. If it is not complete, you will call it as a superior orbital notch. Whenever, see, foramen should be like this, fatha. If this foramen is open, okay, if the foramen is not completed, it is open, then it will become notch. It is not a foramen, it becomes a notch. So here superior orbital foramen, and this one is the inferior orbital foramen. Superior and inferior orbital foramens. The next, inside this orbit you have three foramens. First one is this one is the superior orbital fissure. Okay, superior orbital fissure, where you see the probe will go into the skull. Superior orbital fissure. Other one is inferior orbital fissure. This one, the probe will not go into the cranial cavity. It will go behind into this. It will go into the infratemporal fossa. Okay, this region is the infratemporal fossa. It will go into the infratemporal fossa. So this is superior orbital fissure. Okay, and this one is inferior orbital fissure. Then one more hole should be here, which they have not made, but they have made one representation here. This one is the optic canal. What you see here, this one is the optic canal from which the optic nerve comes. Okay, so superior orbital fissure, inferior orbital fissure, optic canal present here inside the orbit. In this, superior orbital fissure and optic canal are very important. Very, very important. Okay, superior orbital fissure and optic canal are very, very important. Then, so this was the frontalis, the front view. Now going to the occipitalis. Okay, one more important thing here, this area, okay, or this area is called as the glabella. Just remember, this is called as a glabella. Glabella. Okay, here this protuberance here is called as the glabella. From behind, norma occipitalis, because we are seeing the occipit bone from behind. So what are the bones seen? Parietal bone, occipital bone. This suture is the, already I told, lambdoid suture. Then you see one more suture present here, and my sutures are also not clear in this. Okay, in this I'll show little bit more clear. So this, Here's the lambdoid suture, the occipital bone. First we will see the features and then we will come back to this lateral side. What you see here, this prominence is called as the external occipital prominence. External occipital prominence. You have some few arches like this going here. These are called as nuchal lines. You have three nuchal lines. Somewhere here there will be highest nuchal lines, the superior nuchal line, and here you will have the inferior nuchal line. So you have three nuchal lines, highest, superior and the inferior nuchal line. In the center you have the external occipital protuberance. This external occipital protuberance, if you put your finger behind and try to feel it, you can very nicely feel it as a nicely protruding structure behind. Then you can see this projection is the mastoid process. Mastoid process, here also you have the mastoid process. These two are the mastoid processes of the temporal bone. This bone is the temporal bone. Okay, so mastoid process of a temporal bone you can see. Then you can see the then you can see this suture here and this suture here. This is which bone? Occipit. Okay, this is the occipital bone. What is this bone? Temporal. Parietal. Okay, this is temporal. So you have a suture here between this. So this is temporal. Okay, this is parietal. So you have a suture between this occipital bone and the mastoid part of a temporal bone. Okay, occipital bone and mastoid part of a temporal bone. Okay, occipito-mastoid suture, or you can also call occipito-temporal suture. Okay, between parietal bone and temporal bone. Okay, so this is, but this is which part of temporal bone? Mastoid part. So parieto-mastoid suture. This is parieto-mastoid suture, or you can also call parieto-temporal suture. Okay, but this part is a mastoid part, so parieto-mastoid suture. Now what is this swelling? Mastoid process of the temporal bone. Mastoid process of temporal bone. So these are the things which you are seeing from the behind. Then coming to the lateral view, what are the things which are seen in the lateral view are, this completely is the temporal bone, squamous part. Squamous part of temporal bone, mastoid part of temporal bone, two parts. This is the zygomatic part of a temporal bone. This is zygomatic bone. This is zygomatic part of temporal bone. Both these bones together they form the zygomatic arch. So zygomatic arch is formed by two structures, the zygomatic part of temporal bone and the zygomatic bone itself. Okay. Then what are the sutures present here? The suture between the parietal bone and the temporal bone. This suture, what you have seen, this suture. Okay. Then the suture between the zygomatic part of a temporal bone and the zygomatic bone. So here you have this zygomatico-temporal suture present here. Zygomatico-temporal suture. What else is present here? This structure is present here. This structure is called as? Just now I said the name. Arch. What arch? Zygomatic arch. So zygomatic arch is also seen from the lateral aspect. Then you can see that one nice prominent, okay, thin spine like thing projecting down. This is called as the styloid process. This is called as styloid process. What is this? Mastoid process. Okay, mastoid process, styloid process. Remember, mastoid process, styloid process. Okay, so these are the things which are present in lateral. In the next view is the basal view, which is the most complicated view. I will show you that view in this. Okay, in the basal view, first thing what you have, basal view, you can see anterior aspect, this is middle aspect, and this is the posterior aspect. Okay, what you see here, this is the alveolar arch in which the teeth are located. Alveolar arch. This is the hard palate. What is this? This is anterior nasal aperture. Okay, and if I put this probe inside, okay, so this is the posterior nasal aperture, also called as choana. Choana, choana. Okay, the choanas, where the nose opens posteriorly inside. This is the choanas. Okay, I will not waste time by saying all the bony prominences. Instead, I will go directly to the foramens. All these foramens are important. In these, some 5 or 6 are more important. When I am saying, I will say you. Okay, so remember all this. Try to remember these foramens. First, from anterior, we will go posterior, inshallah. This foramen here is called as the incisive fossa. Incisive fossa. This foramen is called incisive fossa. This here you have 2 foramens. This is one big one, this one small one. This is the greater palatine foramen, lesser palatine foramen. Greater palatine foramen and the lesser palatine foramen. Then you have this one and this one. This foramen is called as the foramen lacerum. Lacerum. This is called as the foramen ovale. Foramen ovale is very, very important. Very, very important. Foramen ovale. Okay. So remember foramen ovale. Lacerum also can be asked, but ovale is very important. Many times it has come in examination. Foramen ovale. Then you have the, here you have a small spine here, or here you can see one small spine is present. Next to that one foramen is present. This is called as a foramen spinosum. So foramen lacerum, foramen ovale, foramen spinosum. Now one foramen is present between this styloid process and what is this? Mastoid process. This is called as the stylomastoid foramen. That is also very, very important. Stylomastoid foramen. Okay. So stylomastoid foramen, foramen lacerum, foramen ovale, foramen spinosum. Then you have here you have one, this foramen. This is the carotid canal. Again, carotid canal is also important. Carotid canal, because carotid artery passes through this carotid canal. Here you have one foramen. This is called as the jugular foramen, because jugular vein passes through it. The jugular foramen. One more foramen should be, if I turn it like this, here there should be one canal, okay, which should open here. Okay, that is called as the hypoglossal canal. So remember, here you have the hypoglossal canal. Then what is this one? Foramen magnum. Most important foramen magnum. So whatever foramens I showed you in this, foramen magnum very important, foramen ovale very important, foramen stylomastoid foramen is very important, jugular canal and carotid canal. Jugular foramen and carotid canal. 5 foramen lacerum, 6, okay, and then so these 6 are very very important, remember it, okay, these 6 are very important. Apart from this, what is this? Superior orbital fissure, okay, is also very very important. So these 6 or 7 at least you should know all these foramens. What are the contents of the foramens? Other foramens also can be asked, but for identification other foramens might not be asked. Other foramens might be asked just as a question, but identification, this 6 or 7 foramens can be asked in identification. So I think with this we can complete. One more important, very important thing which I forgot is, what is this one? External acoustic meatus, where your ear opening, okay, your opening of the ear, here it is the external acoustic meatus. Inside here it will open, okay, somewhere in this region. This is not here, actually it should open above. Okay. Here remember as the internal acoustic meatus. This is internal acoustic meatus. This is the external acoustic meatus, and this is internal acoustic meatus. So this was the external aspect of the skull. Now going into the cranial cavity proper. This is the cranial cavity proper. You have anterior cranial fossa, middle cranial fossa. Behind this, posterior cranial fossa, okay, anterior, middle, posterior cranial fossa. In the anterior cranial fossa, important thing which you should know is, this is the cribriform plate of ethmoid bone. Cribriform plate of ethmoid bone. Here you have foramen called as foramen cecum, okay, foramen cecum. Here there should be one foramen, and here there should be one foramen. Actually they are not there, so forget about it, okay. Anterior and posterior ethmoidal foramen should be there. It is not there, so forget about it. Cribriform plate is very important because the first cranial nerve, which is the first cranial nerve? For which sensation? At least that you say me. First cranial nerve is for which sensation? I will give you a clue. Taste, smell, vision. Any one of these 3. Which sensation? Taste, smell, vision. First cranial nerve. First cranial nerve is for smell. Okay. First cranial nerve is for smell. It is not one single nerve. It is multiple small filaments, and these filaments will pass through this cribriform plate. These filaments will pass through this cribriform plate. If you break this cribriform plate, you know where you will reach? You will reach this roof of the nose. The roof of the nose. Okay. So here you have, this is the cribriform plate. In the center of the cribriform plate, what you see here, this projection is called as the crista galli. Crista galli, this projection. Okay. Then if you break this, this is the orbital plate of the frontal bone. Orbital plate of frontal bone. If you break this, you will reach the orbit. Okay. Remember that if you break this, you will reach the orbit down below. So this is orbital plate of a frontal bone. Okay, coming to the middle cranial fossa. What is this? This you already know. Sella turcica. Very good. What is present here? Pituitary gland is present here. Okay. Sella turcica. This is the anterior clinoid process. These two are the anterior clinoid process. These two are the posterior clinoid process. Anterior and posterior clinoid process. And what else? Inside you have many parts of many bones. but if I say you will get confused. So this much, and this one is the internal occipital protuberance. This one was external occipital protuberance. This is the internal occipital protuberance. Now this temporal bone which you are seeing here, it is a very complicated bone. It has many parts. Already I said that this part is the squamous part, this is the mastoid, this is the zygomatic. Inside when you go, you have this part is called as the pittrous part. What it is forming here? Pittrous part of the temporal bone. This one is the pittrous part of the temporal bone, inside which the ear cavity is present, middle ear cavity, okay, the internal acoustic meatus is opening here. Between this external acoustic meatus and the internal acoustic meatus, you will have all the things related to the ear. So this is the pittrous part of the temporal bone. Just remember that at least, because it has all the contents of the ear cavity. Okay, pittrous part of the temporal bone. That's it, inshallah.